are there any relationship between dental implant and skin allergies, or any skin rashes and dental implant? So this is actually based on a question asked by one of the subscribers. He specifically asked, he has got a lot of rashes in his skin, and because of that there are a lot of itching in the skin, but he also has got a missing tooth. Can he get a dental implant done to replace a missing tooth? So let's answer that specific question in this video. Hello all, this is Dr. Arun from Pearls Dentistry, running a dental center in Chennai, Raja Annamalapuram since year 2001. If you have not yet subscribed to our channel, please do subscribe to our channel Pearls Dentistry. We've got a whole bunch of videos coming out on dental health and awareness. Now let's look at two different aspects of it. One, dental implant as a whole, can it cause allergic reaction? Two, what is the skin condition? What are the medication for the skin condition? Will it have a bearing on the dental implant treatment? So if you look at dental implants per se, allergic to titanium, because majority of the dental implants are made with titanium. The cleaner the dental implant, more safer the dental implant it is, more biocompatible the dental implant it is, and more amount of bone formation happens around it. Failure to dental implant is failure on that particular dental implant is very less. So how clean the surfaces will matter a lot when it comes to success of the dental implant. Per se, dental implant is made of titanium. This titanium oxide dioxide coating on the surface, which forms a bone. There is bone formation on the titanium layer. The process is called osseointegration. So this helps the placed dental implant to get firm in the bone, and the bone forms around the dental implant. Known allergies to titanium is documented. It's not that it's not there, but it's at a very minuscule level, very minuscule level. Most often the dental implant doesn't fail because of allergic to titanium, but because of either a surgical problem that is there, not placed well, or a prosthetic problem when the patient is not biting well on that particular tooth is not given well, or the patient is having an issue with their bone, or an overriding medical condition like an uncontrolled diabetes or chronic smoking adds on to the failure of the dental implant rather than an allergic reaction to dental implant. So that's one part. The second part is the skin condition. See, there can be a variety of skin conditions, but there can be certain autoimmune condition which can require some certain specific medication which can affect the bone metabolism. There can be certain skin condition which might require a patient to take oral steroids. So now in those instances, what we need to understand is what is the reason for the skin condition, what are the medication that patient is on. It's very important to tell to the doctor what the skin condition is, what the medication is. For example, if it's going to be a medication that's going to affect the metabolism of bone, then we should be very cautious when you're going to use a dental implant there, because we need that healthy metabolism of bone for the implant to be successful. Or it can be a condition where there are patients are taking on oral steroids. Then it depends on how much of steroid is taken for how long, what is the dosage. Then should we augment the steroids before we actually undertake the procedure, and then we need to take a call based on it. Certain skin condition has got an effect on the oral cavity. It means that there are certain skin conditions which can cause redness or inflammation of the gums. When there is redness or inflammation of the gums, the ability of the patient to keep the dental implant clean will become difficult, or there can be frequent bleeding from the dental implant site near to the tooth next to the dental implant, which can cause failure of the implant. So all these things need to be considered before we actually plan a dental implant. I hope you like this video. If there are any other questions, please do ask in the comment section below. Until next time, this is Dr. Arun from Pearls Dentistry. Bye bye and thank you.